Check the essence and the person. Make sure the essence is safe and the person is unresponsive. Hey, what happened? Do you hear me? Call 911. Your call local emergency number alerts someone nearby to call. Start compressions. Place the heel of one hand of the center of the chest and the other hand of the top of the first hand. Push down 2 to 3 inches, 100 to 120 compressions per minute. Give 30 compressions. Give rescue breath. Pitch the person's nose up shut and give one breath through their mouth. The breath should last about the seconds. Make sure the person's chest rise. Give a second's breath. Continue to cycle. Continue to giving 30 compressions and two breaths until emergency medical persons arrive. Important. If you are not certified in CPR, you can still help by performing HEALS. Only CPR. Compressions only. Until medical help arrives. Always follow the local guidelines and protocols. Thank you.
Hi everyone! Today we're learning about how to help someone with severe bleeding from a dip. This is a serious situation, so remembering the steps could save a life.
Cristita planting pechay to their backyards. Suddenly, she gets a deep cut from cutting plants.
Hi Jelena, I'm planting pechay. Ouch!
In this situation, these are some tips to help Cristita and give first aid. First and foremost, call for help. Dial 911 or your local emergency number immediately. This is the most important step. While waiting for help to arrive, we need to control the bleeding.
Before touching the wound, use gloves.
Before touching the wound, put on gloves or use a clean cloth. Steps will help to protect both of you and the injured person from infection. Now, apply direct pressure to the wound using a clean cloth or bandage. Press firmly and consistently. Don't remove any large objects stuck in the wound. Keep pressing until the bleeding slows down. Since the injured part is in the arm, try to elevate it above the heart to help the blood flow slowly. So, monitor their breathing and pulse. Keep the person calm and warm. Make it sure the situation is under control while waiting for professional medical care.
Remember, severe bleeding is a serious emergency. These steps can help, but they are not a replacement for professional medical care. Always call emergency services immediately. Stay calm, act quickly, and save a life.
What is choking? Choking occurs when a foreign object lodges in the throat or windpipe, blocking the flow of air. And here's what to do.
Are you choking? Bakit na?
If the person is unable to speak and cough it out, they need your help right away. Slap it out, support them leaning forward, give 5 back blows between the shoulder blades. Then after, you have to check the mouth. If back blows doesn't work, try giving an abdominal thrust. Stand behind the patient and put your arms around them, pull sharply inwards and upwards up to 5 times. Then check the mouth again. If there is too much choking, call 911. Keep repeating the 5 back slap and 5 abdominal thrusts until the rescuers arrived.
I'm Rolando A. Elando and welcome to our discussion, a sprained ankle. A sprained ankle is a common injury that can happen to anyone, whether you're an athlete or just going about your daily activities. What a sprained ankle is, its symptoms, treatment options, and when to seek medical attention. Now, One of my friends running and exercising to gain a more strength. So suddenly and fell off. And then she experienced a sprained ankle. Now, let me see how to use a first aid, which is the acronym RICE, which is the RICE. RICE means first, we use and rest. R for rest, for take a break and rest the ankle. Let's get off your feet and take some weight of that ankle. Sit down or lie down and try to avoid putting any pressure on it. Then afterward, we apply the ice to reduce swelling. Applying an ice pack or a bag of a frozen piece, wrap in a towel to the ankle for 15 to 20 minutes. This will help reduce swelling and ease the pain. After putting the ice, then compression. Use a bandage to compress the ankle. Use an elastic bandage to compress the ankle and help reduce swelling. Well, wrap it snugly but not too light. To avoid putting weight on the ankle until the pain subsides, consider using crutches if the pain is severe. If the pain persists or worsens, seek medical attention. Now, after putting a elastic bandage and let it try to elevate the ankle above the level of your heart to reduce swelling, you can prop it up on a pillow or cushion. So here, we use and bag to elevate. Now, to feel better soon, remember to seek medical help if pain persists. Thank you.
Heat stroke or heat exhaustion. A sun-drenched field in People's Park, a young lady is running, enjoying a sunny afternoon. Suddenly, she collapses to the ground, her breathing becoming rapid and shallow. Her skin is flushed and hot. She loses consciousness. To give her a first aid, first thing to do is to move her to a cool area. Get out of direct sunlight. Second, remove excess clothing. Loosen or remove tight clothing. Third, get some cold water and some clean clothes. Wet the clothes and place them on her forehead, neck, and armpits to be able to cool her down and to lower her body temperature. And lastly, to hydrate, give her water to drink or electrolyte-rich drinks.
Hi everyone, this is Jerome Pundar Lapogan from BSED English 1826, and today I'm going to go over splinting procedures. Usually in your first aid kit you don't have any hard objects, so if you're out in a wilderness or any environment, try to find two hard long objects. Today we'll be using two pieces of wood. If you have fractured upper arm, try not to move your arm around too much. The bone inside that's broken can actually cause more damage when you move it around, which is the reason why we're splinting it. Try to put in one hard object on the inside and one of the outside of the arm to keep it from bending. Try to make your material not too thin, cut into the skin, but thin enough to wrap around. When we're wrapping the bandages, make sure that we're not putting it over the joint of the arm. And then before and after, make sure we're always checking the pulse to make sure that we have adequate blood flow still going through the arm. And if not, you can go ahead and press on the nail bed. It will turn white and make sure that it comes back pink, and you know that you got a good blood flow.
It's a windy afternoon. A woman is walking alone in the park when she suddenly has a seizure and falls to the ground. To give her a first aid, we have to follow the steps. During seizure, first, you have to ensure safety. The most important step is to protect the person from injury. Second, clear the area and protect their head with a soft object like a jacket or your hands if possible. Third, time the seizure. Note the time the seizure begins and ends. Most seizures last 1 to 3 minutes. Fourth, recovery position. Once the convulsions stop, carefully turn the person onto their side. This helps prevent choking and allows saliva to drain. And the fifth one is do not restrain. Never try to hold a person down or restrain their movements. This can cause injury. When to seek help. Call emergency services 911 immediately if the seizure lasts longer than 5 minutes. The person has difficulty breathing after the seizure. This is their first seizure. They have injuries. They are pregnant. They have diabetes. The seizure occurs in water. They don't regain consciousness after the seizure. And last, they have multiple seizures without regaining consciousness between them. Remember to stay calm and reassure the person once they regain consciousness. Note down details of the seizure to share with emergency services or medical professionals.
This is called anaphylaxis. Anaphylaxis is a severe, life-threatening allergic reaction that occurs rapidly after exposure to an allergen. For example, you eat some peanuts, shellfish, milks, or eggs, or you have taken pain reliever or penicillin. Even a bee sting or wasp sting can cause anaphylactic reaction. And also the latex. The symptoms for this is, as we have found in our patient, is hives, redness, itching, swelling in the face, lips and throat, shortness of breath, wheezing or coughing, throat tightness and hoarseness, rapid heartbeat, drop in blood pressure, dizziness and fainting, nausea and vomiting, diarrhea, abdominal pain, confusion, sense of doom. And these are what we call the signs and symptoms when the person is undergoing an anaphylaxis. The treatment is to inject epinephrine immediately by a healthcare provider using an EpiPen or similar autoinjector. Call emergency services such as 911, lay the person flat, unless vomiting or conscious. CPR if necessary, and use antihistamines or corticosteroids, but epinephrine is the first and most critical drugs. You can also bring with you antihistamines or those kind of corticosteroids whenever you are going to places such as mountains, or you are not sure, because sometimes you might be bitten or you might eat some allergic foods that are known to cause allergens, so you have to bring an antihistamine drug with you. Also carry an epinephrine auto-injector if at risk, and wear a bracelet saying I am allergic to penicillin, or I am allergic to peanuts, or some other shellfish or seafoods. So this is what we call again anaphylaxis, a condition, a severe, immediate, life-threatening reaction to allergens.
My cousin and I were having coffee this morning when she accidentally spilled hot water on her hand, causing a severe burn. But I treated her properly, following the correct procedures from Born Care. Step 1. Remove clothing and jewelry near to the burn. Step 2. Wash the burn with room temperature water and mild soap. Step 3. Apply antibiotics, ointment, or Vaseline. Step 4. Apply a non-sticky dressing to burns that may get dirty, otherwise leave uncovered. For the step 5, clean with soap and water 3 times a day, then reapply ointment. Step 6. Look out for the sign of infection.
Nosebleedfirst.aid treatment when to seek medical help.
When a nosebleed occurs after a minor injury, the primary goal is to stop the bleeding effectively and quickly. First step, stay calm. It's crucial to remain calm, as panic can worsen the situation and may delay treatment. Your calmness can also help reassure the injured person, especially a child, which can reduce blood flow. Positioning. Have the person sit down and lean slightly forward, not backward. Leaning forward prevents blood from draining down the back of the throat, which can lead to swallowing blood and cause nausea or vomiting. Keep the head higher than the heart also helps reduce blood pressure in the nasal blood vessels. Pinch the nostrils. Use your thumb and index finger to firmly pinch the soft part of the nose just above the nostrils. Ensure the nostrils are completely closed even if the bleeding is only from one side. The pressure should be applied against the nasal septum, which most nosebleed originate to help clot the blood. Breathe through the mouth during this step. Post-bleeding care. Once the bleeding has stopped, advise the person not to blow their nose, pick their nose, or bend down for several hours to prevent rebleeding. Avoid strenuous activities for at least 24 hours. So when to seek medical help? Frequent nosebleeds. If nosebleeds occur frequently, for example several times a week or consistently, this could be a sign of an underlying medical condition such as bleeding disorder, high blood pressure, or a nasal tumor. So medication use. If the person is taking blood thinning medications such as warfarin, aspirin, as these can make nosebleeds harder to stop. Age. Seek medical attention for children younger than 2 years old experiencing a nosebleed. So other symptoms. If nosebleeds are accompanied by other concerning symptoms like headache, fever, lightheadedness, or pale complexion. It is important to seek professional medical attention in certain situations to ensure the nosebleed is not a symptom of a more serious underlying condition. Persistent bleeding. If the nosebleed continues for more than 20 minutes despite applying direct pressure, some sources suggest seeking help if it persists after 2 attempts of 10 to 15 minutes of pressure. Heavy blood loss. If the amount of blood loss is excessive, such as filling a cup,
This can lead to dizziness or lightheadedness, serious injury or trauma. If the nosebleed occurs after a significant injury to the head, face, or nose, such as a car accident or a severe blow, this could indicate a broken nose, skull fracture, or other internal damage. So breathing difficulties, if the nosebleed interferes with breathing or causes choking.